Hello and welcome back to our video series on understanding autism, a guide for parents. This is the second video in our series, and today's video is on autism diagnostic criteria. In our first video, we looked at an overview of ASD, the signs of ASD, and terms to know, and many of those terms to know will be mentioned again during this video. As we go through this second video, we're exploring the diagnostic criteria for ASD, and in our final video, we'll do a step-by-step guide, taking one through the diagnostic process in a rough timeline here at Christian Psychological Associates. Once again, my name is Chris Van Ham. I joined the practice in 2022. My doctoral degree is in clinical psychology. I am a certified autism spectrum disorder clinical specialist, and I'm also a special education teacher. What is ASD? ASD is a neurodevelopmental disorder that impacts communication, interpersonal relationships, and behaviors. ASD is on a spectrum, and it is very broad. How different people present will vary from person to person. And the old adage we talked about in the first video was when you've met one person with autism, you have met one person with autism. ASD can be diagnosed in early childhood, late childhood, adolescence, or adulthood, and it's important to note that males and females often present differently. When diagnosing ASD, we use the DSM-5-TR, a picture of that book is below, and we're looking at three primary criteria: deficits in social communication, restrictive repetitive patterns of behavior, interest, or activities, and symptoms are present from a young age. Going deeper into deficits in social communication and interactions, the first point we're looking for are deficits in social emotional reciprocity. And these can be challenges such as having a normal approach to social interactions, failure to successfully engage in typical back and forth conversations, reduced sharing of others' interests, trouble understanding others' emotions or affects, difficulties initiating or responding to social interactions. Deficits in nonverbal communication can look like poorly integrated verbal and nonverbal communication, unusual or limited eye contact, deficits in understanding body language or the use of gestures, limited or lacking facial expressions, deficits in developing, maintaining, and understanding relationships. For example, this can look like struggles adjusting behavior to match different social contexts, challenges with sharing, challenges with imaginary play, or struggles making friends. It can also look like the absence of interest in peer relationships. Looking at the second criterion, restricted repetitive patterns of behavior, interest, or activities. The first point we're looking for are stereotyped or repetitive movements, use of objects or speech. And this can be things like lining up toys, flipping objects, or echolalia. Insistence on sameness, adherence to routines, ritualized patterns of verbal and nonverbal behavior, and this can look like an insistence on sameness, inflexibility, a need to stick to routine. Ritualized patterns of verbal and nonverbal behavior that can lead to significant dysregulation with small changes, trouble with transitions, rigid, fixed thinking, ritualized greetings, insistence on taking the same route the same way every day, or eating the same food every day. Highly restricted interests that are abnormal in intensity. This can be a strong attachment to or preoccupation with unusual objects, or extremely strong perseverative interests. And unusual interests in the sensory aspects of one's environment. This can be hyposensory reactions, which could look like a lack of response to pain or temperature change, an inability to cope with specific sounds or textures, excessive smelling or touching of objects, or visual fascination with lights or movements. Symptoms must be present from a young age. This is criterion C in the DSM-5-TR. And in very young children, symptoms can be difficult to identify. And there are a lot of reasons for this. Nonlinear development in children. Being unsure what is and is not typical in your child can make it challenging for parents. Masking, especially in girls, can make it difficult to recognize symptoms as well. What we generally look for are when demands start to exceed a child's ability to meet them, especially within social and communicative context. Childcare, if your child participates in a childcare center, that staff can be a great resource for you. And also when your child starts school in a pre-kindergarten, kindergarten, early elementary school, the teachers and the teacher assistants are a tremendous resource for you to get information on how your child is doing. And be aware and be listening for sensory challenges that your child may be having, communication struggles that your child may experience, or social difficulties. Those are often signs for a parent to seek some additional support for their child. In our final video in this series, we'll be taking you through a guide on how we go through the diagnostic process and a rough timeline of how we diagnose here at Christian Psychological Associates. Thank you so much.